Hello everyone, it's Bill the Knee Pain Guru, Bill Paravano the Knee Pain Guru. Today we are going to, it's almost a rapid fire. We've gotten a lot of questions over the past day or so since I started these live streams, which is great. So I have printed out a bunch of the questions we're gonna go over. In back of me, before we get started, in back of me is it's a tufted gray titmouse. The bird had its wing injured and was unable to protect itself. So we had a bird cage. My daughter had a bird previously that is no longer with us, and we got when the bird injured its wing, put it in the bird cage, and we've been feeding it and watering it every day. So that guy gets pretty busy. So anyhow, okay, we are going to go into rapid fire questions that I've received over the past 48 hours on the Knee Pain Guru YouTube channel. So let me switch this around to the questions that I've printed out. This first question is from Yvonne Ray. Hi, Bill. I had a total knee replacement, and I've been told by my consultant that you cannot stretch scar tissue after 12 months as it goes like concrete. I would be interested in what your view is on this. And this was in regards to a video that I've recorded previously on knee pain, arthritis, tendonitis, and maintaining the pain. It is true that scar tissue can get very hard after a certain period of time, but that doesn't mean that the scar tissue can't resolve itself. A lot of times what's happening and why the scar tissue gets more difficult to move is because the mentality is trying to push through the pain, push through the scar tissue. The mentality is to break down the scar tissue, and what ends up happening is there's not a deeper understanding of what's going on in the body when the scar tissue is forming, or why the scar tissue is forming. The scar tissue is there to protect the knee from getting injured further. So without a deeper understanding of what's happening in the knee, scar tissue is going to be there. When we, in my program, Knee Club specifically, we're looking at how we can create comfort in the knee. How we can get in alignment with the body's ability to break down the scar tissue on its own. And in doing so, you increase the range of motion in the knee joint, and it gets easier to move the knee right off the bat without having to break down the scar tissue. The other piece is many times physical therapy or consultants or doctors, they're only looking at the knee joint itself. They're not looking at what's going on in the ankles, in the feet, the hamstrings, the quads, the hips, and the lower back, which must be loose and must have flexibility in order to access the full range of motion in the knee joint. And it's important to understand that once a person has had a total knee replacement, that the knee joint is going to be limited by the total knee replacement. At least from my program's perspective, from the clients that I've worked with, once we get all those components loosened up, the ankles, the feet, hips, lower back, hamstrings, quads, then the limiting factor in that tends to be the knee replacement. So that's my take on that question. See, a few people have joined us. If you have questions, please put those in the comments section. Give the video a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel, as well as turn on notifications for future videos. I'm doing these daily now. Okay, Dezy Princess writes, I went to pain management for 2 years because the pain in my knee was excruciating. Come to find out that after a gel injection in the knee, I decided to go to an orthopedic doctor who told me that my problem was not my knee, it was in my hip. So I got a CAT scan and revealed that my hip was collapsed against the pelvis and ended up getting a hip replacement, so no more knee pain. I like your channel. Well, thank you, Dezy Princess, and I will share this with whoever this is applicable to, and it's more geared towards people who are staring down a knee replacement, or who have been told that they're a perfect candidate for a knee replacement, that or a hip replacement, that's not the panacea that everybody makes it out to be. The hip is in pain, the knee is in pain for a reason, and it is there to make us aware of other factors that are going on in the body. Cutting off the bones and replacing it with plastic and metal forces the body to compensate in different ways, and I've had clients and friends that as they address the one part of the body with a joint replacement, the other parts compensate and they end up replacing the other knee or the hips down the road. So if that's the way you want to play the game, your life, your body, you do what you'd like. However, it's something to definitely be aware of. Don't go into a joint replacement surgery blindly. Ask your doctor plenty of questions. I believe it's important to hold them to a higher standard, because what they're doing is an irreparable procedure on your body. Something to think about. Next question here from Sai. It says, sir, I had done my ACL surgery 15 months ago. Now I am 20 years old. Still, I am not comfortable to run or to play my sport. My leg was so weak and became thin. Please suggest any rehab program. Yes, get over into my knee club program. The more information will be in the description section of this live video once I get to edit that later today. Or you can go to the kneepainguru.com website, and you can learn more about Knee Club there, get involved. Calls on Mondays and Thursdays. They are live. I give you, we customize a program for what's going on with your knees. So that would be the rehab program, and it's all remote. So you could do this at home. You don't have to worry about traveling or dealing with a lot of that other craziness that happens as a result of the conventional medical model. Okay, next question. Toure plays. I twisted my knee while playing football, soccer. Now I can't straighten it. It's interesting. I get lots of they're like comments on my page. What I've noticed after studying pain from my own knee injury 20 some years ago and working with thousands of clients since then, a lot of people don't realize how much pain changes their mind. Pain changes the clarity that they have as far as what they really want. And so what ends up happening is I just get comments like this that's essentially complaining about their knee without any foresight in terms of like, well, what can I do so I can straighten the leg? So I'd encourage you, if you are watching the replay, watching this live, that you ask questions that are specifically designed to get you the outcome that you want. And I'll leave it at that. If that's not clear, ask questions, put those in the comments section, and we'll go there. Okay, Bonnie and the Spirit writes, let me see, how could I view live chat? There it is. Okay. Before I fell to the ground in 2007 and damaged my knees, back, nerves, I was perfectly fine. Now life is healing natural. Jesus has healed me now. Well, congratulations. My question to you is, Bonnie, if that has all happened and you're healing naturally, Why you watching a YouTube video? Why you spending your day watching a YouTube video about getting rid of knee pain? Just something to ask yourself. Okay, let me see. Let's get... Okay, that is... Next question. Question here is, can I still run with a small crack in my cartilage? Nabin writes, I don't know, can you? Can you run with a small crack in your cartilage? Does it hurt? What does your knee feel like? Can you walk without pain? Can you sit without pain? Can you stand without pain? This is where we need to broaden our perspective and understanding of what's going on in the knee and in the body. Will it heal itself? It's going to depend on how you answer those answers to those first questions. So I see Bonnie responded. Let me see there. My issue is today not able to get to the floor on my knees, or if I can't get up. Where's the weakness? Bonnie, think of it as not so much, here we'll keep an eye on the birds that go to the bird feeder. It's not so much that there's a weakness in the knees, it's something else is pulling too tight. So when you fell and you hit the ground, your knees got injured, most likely your hips and lower back tightened up to protect what was going on in the knees. What ends up happening is that creates an imbalance in the body. So most conventional therapies are going to look at how we can strengthen the legs so the knees get stronger, when actually the knees aren't weak. They something else is pulling too tight. Okay, Bonnie writes, where is that? I have started working out on a rebounder 3 months into it. I am strengthening my legs and the upper leg, knee to thighs. And you're still talking about issues. So my question is, are you have to get clear with yourself, is it really working? I mean, like, honest with yourself. And if you're good with what you're doing and the pace that you're progressing, well, great. And if you're not, well, then you have to be honest with yourself and look at something different. Okay. That is that question. Next question here is, so what's the damn stretch? Well, the fact of the matter is, this is my day job. This is all I do. I've done this for the past 12 years online, and I have been working with, since my own knee injury, I started working and studying and traveling around the world. 22 years of experience with this, spent a lot of time, a lot of energy, a lot of money to get to the level of education and understanding in different modalities of body work as far as martial arts and movement and things like that. So if you don't value that, if that is something that is not important to you, then there's probably other YouTube channels out there that you would be more of a fit for. So there you go. I've developed this program over the past 12 years to be able to help people remotely around the world. So I have clients on 6 continents where I work with them and give them specific videos to work with in a members area of my website where they get continual improvement every week. So there you go. There's where the damn stretch is, in my members area. Okay. And this is the last one. Nicole says, I'm at my wit's end and I've just stumbled upon you, and you have given me the first hope in 6 months. I've seen a knee doctor. I worked for an orthopedic for over 14 years. I had an MRI, nothing torn or broken, a small Baker cyst, popliteal cyst, but not big enough to be the problem. It totally feels like nerve pain. And that's the case. All pain in the knee is caused by nerve irritation. Period. End of story, full stop. It's on the medial side, which is the middle, of my right knee. It constantly burns like sweat bees under my skin. It goes from a 4 to an 8 all the time. Help me. Absolutely, Nicole. First, I'll tell you what that tends to be. Having a similar experience in my knee, that when it feels like bees, especially on burning like a bee sting on either side of the knee joint where the knee bends, that happens to be, or what in my experience it's been, because the meniscus is being pinched. And when the meniscus gets pinched, it kind of slides out the side of the knee joint between the two bones. Think of it like a piece of bubble gum that gets squeezed between two bricks. And when that happens, the meniscus, it is painful, it hurts to walk, the knee doesn't feel as stable, and there is a tendency to be real hesitant when you move. So that would be Module 40 in the Pain Pattern Interrupt section of Knee Club. And I would give you, to start with, Modules 1, 2, and 40 to start with for the Knee Club program. Yeah, so that's the gist of it. And I understand, you know, it's like, okay, there's some guy on the internet, people are concerned about doing it remotely, they want to see somebody in person, they want to get help, but they don't want to do anything, so there's like this hesitation to move forward. And I totally get it, I totally understand it, and that's for you to work out for yourself. You could look back, I've got videos on YouTube for the past 12 years. I've been here. If I was going to run a scam or do something, then I would pick an easier subject to scam people on. That's just how it is. It came as a result of my own knee injury, and I found that there are a lot of people in the conventional medical model that really can't help. So I realized that what I discovered was able to, no. What? I'm going to have to look at your schedule. We got the home class thing going on. Okay, I'm going to have to scoot. I saw there was a couple more questions that came in. I'm going to have to pause it for the while. One is, we're doing homeschooling here, and my battery's about to die. If you like the video, give it a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel. Turn on notifications for future videos as I'm doing these questions more on a daily basis, based because I figured out how to do the YouTube lives. You want more information, you want to take action, head on over to the kneepainguru.com website. Watch the video on the homepage, get involved in Knee Club. We got calls on Mondays and Thursdays, so we'll have one tomorrow. Send in your questions. If the idea here is we're changing your mindset. Most people set the bar really low because that's what the medical model tells them. And the medical model has, if something is broken or torn, they're the people that I want in my corner. If nothing is broken or torn and we're only talking about pain, then I'm going to figure it out for myself. So I've developed a resource to help people with that. Okay, Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day. I will see you on the next video. Have a good one.